There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, what things can be done to improve low blood pressure? Answer by Harry Kiesel. This is far more complicated a question than one would expect. To begin with, defining low blood pressure is not that easy. In a pregnant woman of 20 who has a normal blood pressure at baseline, a BP of 90/60 would be common and could not be considered to be low blood pressure, nor could a blood pressure of, say 85/60, in a teenager who felt well and had no symptoms. Hence, even defining low blood pressure requires more than simply focusing on a number. On the other end of the spectrum, a 90-year-old whose baseline BP is 150/90 may have low blood pressure when their BP is 120/70, manifested by symptoms reflecting inadequate blood supply to critical organs, especially the brain. So, it is necessary to include in any numerical definition of low blood pressure the age range and the sorts of symptoms that need to be present to make this call. As already pointed out, dizziness, passing out, a profound sense of weakness, confusion and other symptoms must be considered. As for the cause, this is also a complicated question and requires consideration of various entities and organ systems. The most obvious cause is blood loss severe enough to decrease cardiac output to a level inadequate for the needs of the body, and the brain is the first to manifest this. Endocrine problems are on the list: diabetes insipidus, Addison's disease, withdrawal after long-term high-dose steroids, diabetic ketoacidosis, essentially always complicated by severe dehydration, are some examples. Given the cause of symptomatic low blood pressure, the treatment choices are usually quite small and fairly apparent. Hope that helps. Answer by Hemant Sagar. Okay, try this. If you are already doing this, it's good, but if NT, practice this. Do pranayam early in the morning. I.e. Anulom Vilom and Kapalbhati. Practice this for 1,515 minutes. Before performing pranayam, have almond juice and aloe vera juice with lukewarm water. It should be taken empty stomach. And after this, continue WTH or daily routine, and try to practice Anulom Vilom after every 1 hour and do it for 510 minutes, from 10 a.m. to 5 p.m. Only Anulom Vilom should be practiced anti-Kapalbhati. So by doing it for 510 minutes after every 1 hour, you will create a big cycle of pranayam. And results can be seen in 10-15 days. And again in the evening, Anulom Vilom and Kapalbhati must be practiced. Try this, it will definitely work for you. Answer by Kalyan Kumar. Okay, try this. If you are already doing this, it's good, but if NT, practice this. Do pranayam early in the morning. I.e. Anulom Vilom and Kapalbhati. Practice this for 1,515 minutes. Before performing pranayam, have almond juice and aloe vera juice with lukewarm water. It should be taken empty stomach. And after this, continue WTH or daily routine, and try to practice Anulom Vilom after every 1 hour and do it for 510 minutes, from 10 a.m. to 5 p.m. Only Anulom Vilom should be practiced anti-Kapalbhati. So by doing it for 510 minutes after every 1 hour, you will create a big cycle of pranayam. And results can be seen in 10-15 days. And again in the evening, Anulom Vilom and Kapalbhati must be practiced. Try this, it will definitely work for you.